Perfect.
So with us, this is familiar, you guys of your life, so it was to get deeper into that. He's working at Columbia University Factors and very much.
It's a pleasure all that often. So I'm going results from 3 years of mine in Senegal. So it's although mostly French. Also, as a bit of warning, if there are some words that sound funny, that's my excuse for it. And when I pronounce things, I may sometimes not be well understood. So you let me know if something happens. And same thing, feel free to ask me questions anytime. If something is not clear, just let me know. Okay. So what this project is about is really a measurement project. What we are trying to do is trying to come up with the biggest project. Okay. Now, specific one is adult mortality, and here I'm going to go very fast because you guys are the expert at this and putting this in a global perspective. So we're interested in adult mortality because with recent reductions in child mortality worldwide, there's an increasing proportion of all deaths globally that occur at adult ages, that 15 years and above. And adult mortality also has far-reaching consequences in terms of economic productivity, in terms of closure of businesses, in economies, precipitates household dissolution, which has all kinds of adverse effects. It affects the schooling of children, other outcomes of children, and so on and so forth. Now, the problem I'm going to deal with today is how exactly we go about measuring it. So something that should be of interest to you. In high-income countries, we usually have vital statistics and censuses to measure adult mortality, so it's fairly straightforward for demographers to estimate rates of adult mortality. In low-income countries, on the other hand, these data sources are often not available, and we have to revert to alternatives to estimate these rates. For a long time, people have relied on model life tables, and still there are estimates that are derived from model life tables, where you can derive an estimate of adult mortality based, for example, on estimates of child mortality. Frequently also, demographers relied on what are called unconventional methods, things that we do in surveys in particular to try and recreate data sets that will allow us to measure adult mortality in those settings. And one of these unconventional methods that has garnered a lot of traction recently is what are called sibling survival histories, which I think a lot of you are very familiar with. But basically what these sibling survival histories are, they're a method that we use during surveys, and we ask respondents to first of all list all of their maternal siblings, so siblings of the same biological mother. And for each and every one of these maternal siblings, we ask the respondent to tell us whether that sibling is still alive or not, what is the sex of that sibling, what is their age at the time of the survey, or their age at the time ago they died, before them about their cause of death was related. Good question. What? Give you an answer. Concerns of marriage, or if you of men that can be these underlying methods. What to get answers to the men data, it brings rates of adult mortality directly, and this creates a pseudo data set that is just like a data set that you would collect through life histories, for example. Okay, so it's very convenient. And even in some cases, we can estimate trends in adult mortality from this data. All this with just one cross-sectional survey. So instead of having a fully functional vital registration system that take a lot of time to put in place, we can do this in one survey, one interview with a sample of respondents. So it's very convenient. And as a result, and also I think in large part as a result of efforts coming out of this institute, the sibling survival histories are now spreading very fast in surveys conducted in low-income countries. They've been collected in a large number of demographic and health surveys, for example. They're a key tool in monitoring progress towards some of the Millennium Development Goals, in particular as they relate to maternal mortality. They're a key input, I think, in the global burden of disease study. Some people have used them also to estimate the impact of major global health programs like PEP at AIDS. Use the for example, etc. Of demographic health working.
I have a question about to actually
so, to get into this fact, concern those siblings that selection bias. Not everyone in the population at risk of death, at risk of experiencing the event of interest, has the same probability of being included in the survey that you're conducting. And in particular, as you say, there are some families, there are some groups of brothers and sisters where everybody is dead. Zero survivors, that's a very important issue in that respect. So that's one of the key problems that demographers have been trying to address when dealing with this data and when trying to use this data. The other problem that presents itself with sibling survival history has to do with reporting errors. So reporting errors, by this I mean a situation where respondents report a sibling survival history that differs from the true story, from the actual survival history of their brothers and sisters. And that may be hard to conceive, especially for European. For example, I'm an only child, so my sibling survival history is very short and I have a very low likelihood of making reporting errors in that context. But in low-income countries and places with very high fertility, that becomes a real concern, for example. And this is what we are going to try and address today. Okay? So I'll just say something briefly about sample selection bias. Sample selection bias comes in when mortality is correlated with family size. Okay? When the families where there are a large number of brothers and sisters are also more likely to experience adult deaths than because at a death the correlate with that of the of analysis through different weights, etc.
Family size initial.
So debate about total number that chip or whether for example trying to make adult mortality. It's not the to do is trying to estimate some period in the past. So adulthood. Does that make sense? A lot of people here to clarify. A lot of the actually come out of this institute. The focus, but an important issue. Okay, so in more length and the sibling survival histories that are reported by respondents have only a distant relationship with the actual survival of their sibling. Okay, and to show you how extensive some of these things can be, here I just plotted the number of deaths reported in a typical DHS, which I picked really randomly, the Uganda Demographic and Health Survey, and plotted the number of deaths by year since the survey reported during that DHS. And what you see in that particular DHS is that there are huge heaps of reporting that take place at specific time before the survey. So, for example, a much larger than expected number of deaths are reported to have taken place 10 years before the survey. Same thing 20 years ago. Same thing 30 years ago or so. So there's a lot of heaping in those round digits, you know, the 10 multiples of 10s, multiples of 5. And this for a demographer is a big warning sign that there's something wrong with the data. Okay, that's an indication that respondents may not have an accurate picture of the ages or the dates at which their brothers and sisters experience specific events. Okay, So this is one warning sign about reporting errors in sibling survival histories. Other warning signs include, for example, imbalanced sex ratios at birth. When you ask respondents to tell you about their siblings, you would expect a balanced sex ratio at birth because they report on the entire population. Well, that's often not the case. Very often you have a lot more men that are reported during these surveys than expected. Same thing also, you find very improbable fertility trends implied by the sibling survival history. So for example, things like very sharply declining fertility and so on and so forth, or increasing, it depends on the context, but things that just do not align, that do not match with the more direct estimates of fertility that we have elsewhere. Okay? And overall, the concern about this data is that there is a significant underreporting of deaths in those sibling survival to adult mortality rate. What do we do? That they're in siblings? Well, there are of attitude for this all together. Basically throw your hands in the air and just say, well, what can we do? You know, this is what people report, and for a while that's been the attitude that people, that demographers have taken. Another way to deal with this is to try and correct reporting errors through analytical techniques. Okay, try to find statistical models that somehow adjust for the missing deaths, that somehow add deaths back where they should be and where we think they are missing, and that's something also that has been worked on. That's been the primary approach to addressing this sibling survival history. But there is one other approach. It's to try and collect better sibling survival histories, to try and help the respondents and the interviewers make sure that the data that they collect are at least more accurate, if not in work here. Okay, and that you can try and follow. I think that this survival history either through models or through analytical procedure. The first one is to try and understand what exactly are those errors and to come up with a typology of those reporting errors. And in current work on analytical procedures, for example, people have generally assumed that these errors mean basically omitting the deaths of one of your siblings. You just forget to report that yes, you've had one brother or one sister that has died at some time ago before the survey. Well, in fact, things are a little bit more complicated than this. There are 4 types of errors that can come across those sibling survival histories, including, for example, list errors, of which those omissions are one potential list error, but other list errors, for example, include adding extra siblings to the list of your maternal siblings, which may happen, for example, sorry, when you live in large families where there are multiple marriages, where there are foster children, and so on and so forth. You may have inclusions here that are not maternal siblings. Other errors may occur on the vital status of the siblings. So you report when in fact it still happened in to do with age or just their sibling age, to do with date error, for example, depending. What that creates actually is way various diagrams for it. X-axis here of age, and we typically focus on the rectangle of this diagram that starts at age 15, ends at age 60, and stretches between 2 relatively recent years, because generally we think that the data that pertains to years far back in the past is essentially garbage. We can't really use it, so we focus on the more recent years. But even on the more recent years, you have all these kind of translations that may occur. So, for example, the death of some brother that has occurred before age 15 and more than 10 years ago may be moved by the respondent into the rectangle that we are analyzing in our study. So it may be reported as having taken place at age 17 and 6 years ago, for example. Okay, so that creates big issues. And in order to estimate the impact of reporting errors on estimates of adult mortality, we kind of need to have a sense of where these flows are coming from, where they are going to, and how big they are. Essentially, one thing that we need to correct errors is come about during a responsible. And in current work, I think that the problem is with this person, okay, because either they don't remember things. The problem is recall, okay, and they may not remember distant events and things that happened in the past, so that creates reporting errors. Or they may be really tired of answering questions, they don't want to answer, so they just cut part of the sibling survival history short, and in the end we have deaths that are omitted during this interview, for example. Okay, so that's where most of our focus is. But some of the errors, actually, I think, in my view, a lot of the errors also come from the interviewers. In a lot of these surveys, for example, interviewers are paid by the interview, or they get incentives if they do extra interviews. So if they come to a respondent's house and that respondent has had, 12 brothers and sisters, that interviewer is not going to be happy about that and may not go through the entire list of siblings that particular respondents may report, okay, because the interviewer wants to get that incentive or that extra money that they would get from doing an extra interview in a particular day, okay. So that's part of the issue. We kind of need to know what's going on in this interaction to later either adjust the mortality estimates or collect better data. Okay. So what we've done here is in our work is to try and collect better data by working with several demographic research sites in Senegal, which is here in West Africa. And those research sites are what we call demographic surveillance sites. And I'm going to talk in a bit more detail about what this is in a second. And our goal, as I said, is to try and improve the accuracy of the sibling survival history. And we've done two things. The first was to conduct a pilot study to try and understand what kind of errors are most prevalent and where they're coming from. And the second thing that we've done is that based on this pilot study, we've devised a new questionnaire to elicit sibling survival history, and we've tested it in those demographic surveillance sites. So I'm going to describe those two things in turn. Okay, I don't have a sense of time. Is there a clock somewhere? Oh, okay. All right. Thank you. Okay, so why work in these demographic surveillance areas and what are they? So demographic surveillance systems are small areas in a particular country where there has been continuous monitoring of demographic events over a rather long period of time already. And by this, I mean really that deaths and births and marriages and so on and so forth that affect this population are monitored on a quarterly basis almost. And what this does for us is that it gives us very high quality data on mortality, very high frequency of household visits, for example. So we are pretty sure that we are capturing a lot of the deaths that occur within a population. Provides genealogic winners and sisters of a which is a tremendous survival. And on targeting rare events, want to do populations very large. We are targeting those. So worst, try to find and completely. Sorry, that's completely at the southeastern tip of Senegal, a very remote place. very highly impoverished, but demographic surveillance has been going on since the 1970s. So we have very long-standing data on adult mortality. And on top of it, we have very, very detailed genealogical data, because this research site started as a study of, for example, I think the malaria were very interested in knowing who was related to whom within the population. So we have this. And what we've done here is what is known as a record linkage study, meaning that within this population, we conducted a survey that's similar to what you would do during a demographic and health survey, during the big national scale DHS survey. And subsequently, we've linked what people told us about their brothers and sisters to what was known, what was observed as part of demographic surveillance, okay? One by one. So we try to find each and every one of their siblings into the demographic surveillance data set. And what that gives us is the opportunity to really determine where the reporting errors are coming from by, for example, realizing that, well, the demographic surveillance tells us that such a respondent has a brother whose name is John, and John wasn't reported during the sibling survival history. Same thing, James wasn't reported, but on the other hand, the demographic surveillance does not have any information on Mary, but Mary was reported during that time, and we can also, we can also check the ages, for example. We can check, for example, that the respondent tells us that Paul is 35, whereas in fact in the demographic surveillance system, Paul is 32. Okay, so it's very detailed, and we can really get at the bottom of those reporting errors. Yes?
So did you actually match based on first name and age? Those are the two things that you used to match? Where did you get names?
So how matching the first age, we didn't vital state any. Okay, so left us what we used to match reports to the demographic and names of potential of the brothers and sisters and algorithm in fuzzy matching that well UL or same. So that's used to so interview case. What in terms of we found that respondents do forget to mention some of their sisters who are still alive, but it's a fairly small proportion. They forget to mention a much larger proportion of their deceased sisters, up to 10% almost. And in particular, they forget to mention a lot of the sisters who have moved out of the demographic surveillance area. So these are people who have migrated to the city and so on and so forth. Okay? And in terms of the factors explaining these omissions, the respondents who were much more likely to omit some of their sisters during the study tended to have a different biological father as the sibling they were omitting. Okay, so that increased the risk of omission. They tended to be migrants, people we interviewed in Dakar or in other parts of the country rather than in the demographic surveillance area. And the young ones in the populations were very either forgetful, or they did not care, or they did not have patience to go through the sibling survival history. But in the end, they underreported a lot more than other people. Yeah.
The respondent characteristics or the sibling characteristics?
The respondent characteristics. And yes. First of all, so we decided to just be, first we went to be for the sibling survival. Recently, that's have been asked, and we focus on sisters because that to do with it. For example, the fact which meant that were represent, and in the end we didn't have in that data. Okay, but so that's what we found. This one of the big issues with those age errors was extremely messy, with respondents on average underestimating the age of their live sisters by close to 2 years, underestimating the age of their deceased sisters by close to 4 years, And more importantly, I think that there was very large variations in age errors. You know, the standard deviations of errors was huge, and I have some explanation for that. But first, the question.
How do you know the right age? Against what do you compare?
So the right age, how do we know the right age? Well, we know it for several reasons. First of all, they've been studied since the 1970s. So 1970, so a lot of them were actually born within the surveillance area, so they were observed. So we know the exact date of birth. And for those who weren't, who were already born before the demographic surveillance started, the people who started demographic surveillance actually did a very careful age assessment where they ranked people in the population by birth cohort, and in that setting in particular there are very clear circumcision rights, for example, that people know when that took place, so they use that to anchor the estimation of age. So it's fairly precise. I mean, in terms of estimation of age, it's about as good as you're going to get for people born before. Yes, I think at the back first. And
Methodology. You might get into this later, but how many years ago did they die? About 10. What year did they die? Oh, 1972. Related to
So the answer to this is I'll show you a little bit later when we try to develop. Okay, because when you modify the methodology, you get very different results. Okay.
Last statement that the magnitude of errors increase with the age of the sister. Does the difference in age from the respondent to the sister matter?
Well, that was our hypothesis also coming in, whether the difference between the age gap between siblings would matter more than the actual age of the person. It doesn't. It's really the age, the true age of the person, the actual age of the person. But to some extent, these things are correlated too. So it's kind of hard to tease apart. Okay. So, but in the end, ultimately, what we did find what we did is we tried to estimate adult mortality among this population, this very well-defined group of people that we interviewed and their brothers and sisters. And so this is a group where we know there isn't any sample selection bias because the person have been interviewed, and so that's controlled for. And we can see the net effect of those reporting errors on mortality rates, on estimates of mortality rates. And so we compared the estimate we get from the sibling survival histories, so that's the triangles, to the estimate we get from the demographic surveillance data, and that's the circles. And what we find is that for most of adulthood up until age 50, both estimates align fairly well. Okay? But when you get to age 50 and above, things start to diverge very significantly, and in the end, the estimates of survival between 15 and 60 is lower by 20% in the sibling survival data than what is observed in the demographic surveillance data. Okay? Yeah.
What were the age ranges of the respondents?
Respondents were 15 to 59. I've seen another. That answered your question. Okay, so that's what you get. And every time I show this graph, people tell me, well, then there's a very simple fix. Why don't we just measure on the 15 to 50-year-old range and not bother about this 45Q15 so that you don't have the problem? Well, it's not that simple, because this almost perfect alignment here doesn't mean that the input data is of good quality. It just means that by a lucky balancing act, if you want, some of the deaths that take place here are translated down there because the respondents underestimate the age of their the age at death of their sisters. And so these deaths that come from here and are moved down there at other ages, they replace the deaths that are forgotten, that are omitted during the survey at that time. Okay? What's happening here is that this kind of replacement doesn't take place anymore because there are very few population. Okay, so what you have here is the fact that well, the gap increases because forgetting and omissions, because omissions occur, but you don't have enough replacement coming from the older age groups. Okay, so all this to say that this is a rather fortunate occurrence here, and you cannot bank on this happening in each and every population that you're going to study. Okay, so that's I think where we left things here. Any questions at this point? Yes.
So I have a question about the previous slide.
Yeah, I'm trying to go back.
So you started, the demographic center started 1970.
Yeah.
So the ages greater than
Yes.
can be similar to age 20. Why? So that's the reason. Yeah.
So if I further the DS data.
To observe the difficult because that is 20 years from and the article 20 demography than the if you go underestimate it, so that's
So actually here it may be a bit different, because this does not mean that these deaths, for example, took place 60 years ago. And this is somebody who died at age 60, but maybe last year. And so the recall in that context may be short as well. And this may be more recent deaths. Yeah.
Age refers to the respondent or the sibling?
This is the age at death of the sibling. Sorry, I wasn't clear about that.
so age of death, but the birth date of the 60 years ago.
No. So the age at death here is by looking at the slope of that curve, right? So you can just tell that people are dying between that time point, and that there's probably one person who died between those two ages. You see what I mean?
Yes, I'm thinking about when you ask people, you wanted to identify the date of age. So because at the 1970, the guy that died was 10 years at 97.
Mm-hmm.
So when you ask him at that time, when did you, were you born, he may have problem, and remembering the 2 years or something. So I mean that even this X, when you go after before 97 birth.
Not sure. I get your point. I think it would be interesting to talk about this more. I thought initially what you were referring to was that, well, the comparison data here are people who were born before the demographic surveillance started. But I think you have a deeper point. Yeah.
Question. Blackline, did you do uncertainty intervals? Because you have errors significantly different. Are they significant?
Yeah, we ran models on this, and so we ran some models that tested for an inflection point around here, and that inflection point is significant. So, basic Cox regression. We pooled all the observations, and we just added a dummy that indicates that the observation was coming from the sibling survival history, the demographic surveillance. Okay? Yeah.
Overlaps and redundancy with data where that drives the high probability for collecting some siblings from the same family and they are clustered in the special area.
So if there are multiple, if respondents coming from the same families, we had respondents coming from the same, and in STS, by using robust standard errors and things like this, all what we did is one respondent only, and we reestimated the rate. So that's not what's driving this. Yes.
So the y-axis.
Yeah.
So indicated by the actual change in the stock and family size. If the system is deceased, then you're looking at family size is decreasing over time. then there might be some.
That's the way these things are used. You just then analyze it as if it's a random sample interest. Question back there?
Suppose there's a correlation between people dying in the same family. The people who are more likely to die, both siblings will die, and they won't get counted.
Yes, so the question about sample selection biases, and so for that by design, because we focus on respondents where we knew there was one member of the SIP who survey. So these rates are not representative of the families that are included in the sample, that are included in the study. Okay, so that's what I meant when I said that because we just focus on this known subset of families within the population. Let me just move forward a bit because I think we're going to run out of time soon, and I do want to talk about this new questionnaire we've been working on. And essentially, we try to address some of these questions about the methodology of the survey and if there are things that we can modify to reduce the reporting errors that we see in the data here. And to do this, we borrowed well-known techniques. We didn't invent a single thing. We borrowed well-known techniques, for example, that people use in sexual networking research, which is what I used to do in the not too distant past, or for example, food intake measurement and things like this to try and improve the reporting of events or activities. And the other thing that we did is that we adopted what's known in survey research as a life calendar or event history calendar to try and record the dates of events and the ages of siblings a little bit better, a bit more accurately than just say this took place 10 years ago, this took place 20 years ago, my brother is 50, my brother is 30. Okay, so that was our approach. And so what this resulted into is a bunch of what are known as supplementary interviewing techniques. So things that you can add to a questionnaire or to an instrument to get better data. And it came down to 4 of them for us. The first one is that we told in our interviewers to go through a standardized script to try and sensitize the respondent to the issue of good reporting. Okay, because sometimes people just go thinking that, well, it actually matters. Just these 2-3 sentences to try and motivate the interviewer, because her that to report accurately. Well, maybe that's gonna help them not cut, at least our thinking. Second thing we added here was we kind of relaxed one of the constraint instruments used in the DHS, where respondents are asked to list their brothers and sisters is the oldest one. So it takes a bit of time, etc., etc. So here we just told them, just tell us who your brothers and sisters are, and we'll later. Okay, so in survey research, that often works. The trick to generate more names without the relations. And third one, something very simple as well. Once you've collected that list, you just back to the respondent, starting with the last mentioned sibling, and you just ask the respondent else. You just try to encourage them, give them more opportunities to report forgotten. Okay. Then, based on our pilot study, we also added a few recall cues, specific things we know are often omitted during the survey that we're trying to bring back into the interview. First of all, first and foremost, asking respondents whether there are deceased siblings that they may have forgotten or they may not have reported. Then, since we had so much trouble with the siblings that were lost to follow-up in the demographic surveillance, we asked them also to list whether there were siblings that had migrated elsewhere. And to help them with this, we gave them a list of the different cities where people go in Senegal, where people migrate to. So we asked them, are there any other siblings that maybe have migrated? Maybe they went to Dakar, maybe they went to Mbour, maybe they went to all these other places and went through the list like this. And finally, whether there were other siblings who had a different biological father, because we saw that this was a big issue also in terms of omission. Okay, and eventually we added this calendar format to collect data rather than the close-ended questions that just ask how old was he, when did he die, and so on and so forth. And the calendar looks something like this, which I was hoping would be in the right orientation, but I guess you can all go like this. But what it does, essentially, bear with me here, is that it's bracketed by years, going down like this, and duration, going up like this. Okay? Here you have a bunch of events of national relevance, only national relevance, because we wanted to make sure we were in the same context as a demographic and health service, for example. And different things, you know, elections, famous soccer games. The first event that made it on that thing was when Senegal beat France in the 2002 World Cup, for example. I was very upset about that. Then here we have a section about the personal events that mattered in the life of the respondent. For example, birth of the children, changes in residence, schooling, etc., where we collect this information first to try and anchor the reporting of the sibling survival history. The sibling survival history now goes onto this. Okay, and what it ends up looking like is that you would put a B here, for example, for birth, and let's say that sibling died somewhere around here, you would put a D down there and draw a line, draw a straight line. Okay, if the sibling did not die, draw a line all the way to the end. Fairly simple, fairly straightforward, a lot more practical, we think, than the DHS questionnaire. The next steps for us were to test this in a randomized control trial. So draw a sample of respondents from one of those demographic surveillance sites, interview half with the DHS questionnaire, interview the other half with our new questionnaire. We did this in this very famous demographic surveillance site because it's the oldest in Africa. For all I know, the oldest in the world as well. It started in 1962. And in the interest of time, I'm not going to describe the setting all that much, but they do go through the same demographic surveillance process as I described before. Now, we actually enrolled both women and men in that trial, unlike our pilot study. Eligibility criteria for the trial were we needed to interview people who had ever been members of the demographic surveillance site, ages 15 to 59, and with at least one known sibling in the demographic surveillance site. Okay. Then we oversampled families where there was an adult death, again, to try and save some resources. In some families, we interviewed 2 respondents to look at whether they report the same thing or not about their other brothers and sisters. And what we did also that's important is that instead of just working within the demographic surveillance area this time, we went looking for respondents all over the place, in particular in Dakar, where a lot of people migrate to in Senegal, and in Bour here, which is a big migration destination. And we went to look for these migrants because we tend to think that they report much less accurately than the people who remain home. So I'll skip that in the interest of time. We hired a team of 8 interviewers to carry out that trials. And importantly, these were all interviewers who had just finished the 2010-2011 Senegal DHS. Okay, so they had all the habits of the interviewers that work in those large-scale surveys. We did control and experimental groups in sequence. So we started by the DHS questionnaire. Then we introduced the new questionnaire because we were worried about contamination between the 2 groups. Okay, and so this went on between January and March of this year. we did 614 DHS interviews, 575 new questionnaire interviews, which we called sibling survival calendar. Randomization worked fairly well. There were no differences between the two groups in terms of their background characteristics and things that were possibly related to reporting. Now, to the punchline. Does it work? Does this new approach to collecting sibling survival histories work? I'll let you answer that question for you. I'll just present some of our results. Whether it reduces heaping, so this tendency of reporting things in round numbers. The red line is the DHS questionnaire. The black line is the new questionnaire. So you can see that some of these huge heaps that we find in the DHS questionnaire disappear in the new questionnaire when you're talking about reported age at death, for example. And same thing when we talk about reported date at death of those siblings. There's huge amount of heaping in the DHS questionnaire, 10 years, 20 years, 40 years here. There's none of that in the new questionnaire. Okay? So that's the first thing. The second set of results has to do with the sensitivity of this data. And by this, I mean, if the demographic surveillance, so if the continuous monitoring of mortality in that population tells us that there was an adult death in that family, does the respondent we interview actually report it during the survey? Okay, so that's one of the key outcomes we're interested in because we want to reduce those omissions. And in the DHS questionnaire, when we talk about female deaths, so the deaths of sisters of respondents, only 75% of respondents in one of those families where there was a death among adult females actually reported it during the survey when we used the DHS questionnaire. Okay? When we used our new questionnaire, this percentage increased to 91%, so a significant reduction in the likelihood of omission. So we were quite pleased about. Didn't work quite as nicely for the reporting of brothers. The deaths that have occurred to the brothers of the respondents, where sensitivity stayed about the same at about 85%. Our key results. Then we checked also whether this new questionnaire could make things worse, actually, in terms of respondents reporting deaths of brothers and sisters even when there wasn't one, just because the interviewer kept asking, are you sure you don't have a brother who died? Are you sure you don't have a... So yes, okay, I'll tell you about somebody so I can go on with my life. Well, that wasn't the case. Specificity of these questionnaires were roughly similar, maybe even a bit better with our new questionnaire. For female deaths, same for male deaths. So the specificity did not decrease by using those questionnaires. So on one end, you get a more accurate reporting of the deaths you actually expect. On the other hand, you don't get a worse reporting of the deaths you don't expect. So that's positive sign. Okay, I'm going to skip over all of this, but you can look into this if you want later. The key question this forward is whether this takes a long time to complete because, these these large national competing sections of the questionnaire, and if you increase the section that's devoted to sibling survival history, maternal mortality, there's going to be a lot of pushback. So we want to make sure we get through this in a relatively comparable amount of time. And on average, completing the DHS questionnaire took 30 minutes. So that's what you see up here. No, that's what you see down here. Versus 35 minutes on average for the sibling survival questionnaire. Okay, so it's a significantly longer questionnaire by 5 minutes. But on the other hand, it's not like it took 2 or 3 times longer. It's just 5 extra minutes. On top of it, during that trial, we were also learning about training on this questionnaire. So we didn't have an excellent training protocol. We were kind of learning on the fly about what the problems were and things like this. So maybe we can bring that amount of time further down. And there is also very significant variation across interviewers. Some interviewers get it, some interviewers just don't. And if you see here, there are some small data points of interviews that lasted an incredible amount of time. Okay, so that's part of the problem, and I blame the interviewers for this. Of course, not my training skills. Okay, so in conclusion, what I think we look at this as a proof of concept that yes, you can actually improve these data that are used for demographic estimation when there's very limited vital registration in a country. And we also think it can be improved further, for example, by designing additional recall queues or by integrating different parts of the questionnaire. Because you see that the DHS questionnaire, for example, you collect a birth history, then you're going to collect a sibling survival history, where with our calendar, we put both on the same thing, so you have kind of efficiency gains. We can get through things much quicker in this way. Our next step, we are going to do this detailed linkage of the sibling survival history and the demographic surveillance in the trial data to try and see whether the calendar improves age reports, improves date reports, how that comes about. We also want to investigate misclassification in causes of death. So the demographic surveillance systems collect all these verbal autopsy data. We want to compare the verbal autopsies to what the siblings actually report about a specific brother or sister and see whether there are systematic problems here. And we are using micro-simulations now to try and assess whether this improved specificity and sensitivity actually translate in reduced bias in estimates, because that's not a given, because in some settings, the fact that the specificity, for example, isn't perfect, you may add some deaths one way that you take back another way, and things kind of offset each other in the end in a lucky manner. So we are trying to map that out with micro-simulations. Okay, and in medium-term horizon, we're trying to replicate these trials under different conditions. First, different epidemiological conditions. Senegal, for example, has very low HIV, so that's something that affects whether or not we can generalize our results. We want to see whether that works also in those other conditions. Different societal conditions, looking in particular at matrilineal society, where brothers and sisters co-reside in the family of the mother, which makes reporting very different than what you've seen here in Senegal, which is a patrilineal society, and different data collection society. Ultimately, we hope to incorporate this into an actual DHS to try and see how the calendar is perceived and received after already, 200 questions about breastfeeding and all sorts of children outcomes and so on and so forth. So it may be a very different reception at that time. Okay, so that's what we're trying to do. We're excited about it. I hope you guys are too now. We'll see. So thank you very much.
Thank you very much, Stéphane. But Stéphane will be here. We don't
I'll be here.
Go. But thank you everybody for Stéphane. If you have any other questions. Thanks a lot.
Thank you. Sorry I took too long. Sorry.